baby's cry can be upsetting and frustrating. It is designed to get your attention, but you may be worried that something is wrong. Your baby may start to cry more at 2 weeks of age and may increase until it reaches a peak at 6 to 8 weeks. There's a few things that you could do to help settle your baby when they're crying. Talk or sing to your baby, hold them close, let them hear a repetitive or soothing sound, go for a walk outside, or give them a warm bath. Not every baby is easy to calm, but that doesn't mean you're doing anything wrong. Don't get angry with your baby or yourself. If you feel you're becoming stressed, put your baby down in a safe place, walk away and take some time to calm yourself down. You could try listening to some music, doing some exercise, or calling a friend or relative who may be able to help you calm down or help come and care for your baby. After a few moments, when you are calm, go back and check your baby. The only way to completely protect your baby from secondhand smoke is to make your home and car entirely smoke-free. Smoking by a window or back door is not enough, as over 80% of secondhand smoke is invisible and contains more than 4,500 harmful cancer-causing chemicals, toxins and poisons. Exposure to secondhand smoke puts babies at risk and can cause serious health problems for children and adults. Smoking damages our lungs, causes cancer and is now the biggest risk for cot death. If you smoke, you need to think about the effects for your family and your baby. Giving up smoking or making sure you have a completely smoke-free home and car is the only way to protect those that you love. If you would like help to quit, there is excellent support and advice available. Speak to a member of staff today or get in touch with your local stop smoking service, GP or pharmacist, or visit nhs.uk/smoke-free. It's normal for parents to get stressed, especially by crying. Put some time aside for yourself and take care of your needs as well as those of your baby. Shouting, getting angry or handling your baby roughly will make things worse and make them more upset. Sometimes parents and people looking after babies get angry and frustrated with a baby's cry and they lose control. They act on impulse and may shake their baby. Shaking or losing your temper with a baby is very dangerous and can cause blindness, learning disabilities, seizures, physical disabilities and even death. It's important to remember infant crying is normal and it will stop. Comfort methods can sometimes soothe your baby, and it's okay to walk away if you've checked your baby is safe and the crying is getting to you. Never shake or hurt a baby.
Hello, my name is Stephanie and I am part of the South Tees Maternity Neonatal Voices Partnership, also known as the MNVP. The MNVP is made up of service users, healthcare professionals and representation from community organisations, all working together to help improve maternity and neonatal care. We work really closely with South Tees maternity services and the neonatal unit, both here at James Cook and the maternity unit at the Friarage. We have a great relationship with all units and we all share the same aim to help shape our local maternity and neonatal care. As an MVP though, we are a totally independent service, and this allows us to bring your service user voice and experience to the centre of discussions around the development and implementation of your care. We do this through engaging with those who have recently used the service and those who are supporting you through your pregnancy, birth and beyond. We host bi-monthly meetings, we engage through social media, we visit established groups, we work with community organisations and we host engagement events. Your feedback and engagement is really important, and if you'd like to speak to someone about your experience, or if you'd just like to know more about the MMVP and how you may want to get involved, then please email southtees@mapvoices.uk. We would love to hear from you and we invite you to be part of shaping your maternity services.
In the postnatal period, it is very important to have good hygiene and reduce the risk of infection for you and your baby. It includes daily showering, frequent changing of sanitary pads and hand washing before and after going to the toilet or changing your pads. If you've had a vaginal tear, also known as a perineal tear, an episiotomy or a caesarean section, you should look out for the following signs of infection. Increase in redness, swelling or leakage from the womb. Increased redness may look different on darker skin tones, so it may look purple or brown. Excessive pain, discomfort or swelling, new or increased bleeding, an unusual or unpleasant smell, If you begin to feel generally unwell or have a high temperature, or your wound has areas which have opened. Each time you see your midwife, you will be asked if you have any concerns about your wound and offered an inspection. We recommend an inspection of your wound as the midwife may be able to spot early signs of infection before you become unwell. And early identification is likely to improve the healing outcome of your wound. If you have any concerns about your bleeding, vaginal or caesarean section wound, contact your midwife or ring our maternity advice line.
You are advised to seek advice from your GP or NHS 111 if your baby shows any of the following signs and symptoms: a sudden change in their behaviour, feverish and irritable, cool and lethargic, has a high temperature or feels clammy, a changing feeding pattern, usually becoming disinterested and reluctant to feed, vomiting when this has not previously been a problem, a change in stools, more frequent, loose, watery or more explosive than usual, is less aware of you, is more floppy than usual, breathing more rapidly, noisily, or there may be pauses between some breaths, is more pale than usual. You are advised to seek urgent medical attention by dialing 999 and asking for an ambulance if your baby shows any of the following signs and symptoms: stops breathing or goes blue, is unresponsive or seems unaware, has glazed eyes and doesn't seem to focus, cannot be woken, has a convulsion even if your baby appears to recover, has blotchy skin or a rash.